Good morning. My name is Alex Serrano. I'm the Chief Nurse Executive at AZRMC. Today we will discuss our budget plan proposal for a diabetic wound care, preventative self-care, and a specialized treatment clinic. The diabetic population of this urban area does exceed a high volume population as evidenced by local demographics researched through the city's database and the local CDC numbers for this county. We do have an average daily census of inpatients um, receiving complex wound care with a history of diabetes at 31 patients per day, with an 18% readmission rate, which is contributing significantly to high cost of healthcare for not only our patients but also for the organization. This uh, budget deficit needs to be addressed. Otherwise, we will continue to not only have a high uh, percentage of hospitalizations and readmissions, but at the same time, we will have a fiscal deficit that will be very difficult to recover from as the months and the years go by. The rationale for this budget plan proposal is to resolve these concerns with an outpatient clinic that provides um, specialized RN diabetic educational self-care services and easy access to care via outpatient clinic Monday through Friday, uh, 8 to 5 appointments, whether by um, uh, patient face-to-face visit or by telemedicine services. Um, we anticipate that the fiscal risk for our patients will be minimal in an outpatient setting. We anticipate that the rate of hospitalizations will decrease from 18% to less than 10%, and our patients will remain free from hospitalization due to ongoing, continuous quality care as provided by a specialized nurse practitioner uh, who is a subject matter expert in diabetic wound care management, and two registered nurses that are subject matter experts in education care management and self care uh, detailed instruction. The implementation strategy for this budget plan proposal is to um, target the population that is first and foremost uh, being admitted to the hospital, our hospital, at a high rate, and those are diabetics who are generally uncontrolled with an A1C of 8 or greater, who have had wound uh, care complications or currently have wound care problems that require intensive acute care hospitalization. The secondary goals of this clinic is to not only provide those complex wound care services, but to prevent uncontrolled diabetes with effective and realistic education that addresses their individualized care needs. Um, those will include the services of a dietitian. They will include ongoing follow ups and a unique plan of care for each patient. Again, we will facilitate um, access to these appointments with telemedicine uh, applications that are user friendly for our population. Um, we find that the majority of our population may already own a phone or a computer, and we will provide the extra effort to educate them and help them download the application necessary to continue with easy access to telemedicine services. Uh, the projected the projected population at the beginning of the fiscal year for July 1st to 2021 to June uh, 30th, 2022. We'll average 0 patients within the first to 2 months as we continue to advertise and market the outpatient clinic. We will increase our population to approximately 220 patients after the first quarter and um, increase that population to over 660 patients within months 6 to months 12. Based on those numbers, we project that the revenue will come in from the following sources. AZRMC will, of course, provide 200,000 upfront costs to begin operations. Medicare will provide approximately $120 per patient visit for an average of 300 patients. Um, Medicaid will provide approximately $90 per patient for approximately 40 patients per month. Self-pay patients will average approximately 4 to 5 patients per month at $50 per patient, and private insurance will pay approximately $150 per patient as the clinic increases their population to 320 patients by the end of February 2021. If the projections uh, do add up to the following numbers, patient numbers, I'm sorry, then the total revenue is anticipated to be $961,560 at the end of the first year. Looking at operating expenses, we do need the following staff um, to implement the services I just spoke about and manage all operating clinical procedures and costs. The nurse practitioner, one nurse practitioner specialized in diabetic wound care, um, will be necessary. Um, she will average about $11,000 per month, followed by 2 registered nurses at $7,000 per month, with a front desk assistant at $3,144 per month, and a director of nurses at $13,000 per month, necessary to um, uh, handle all operating costs, performance indicators, and report to our executive branch. Our dietitian, who will have a starting salary of $5,631, will also be necessary to provide unique, detailed plans for this patient population, followed by a nurse manager to handle all daily operational tasks and follow ups. Employee benefits are calculated at 25% of their salaries, and they are factored for a total of 135,717, with Medicare taxes threshold with a total threshold of 137,700. There are some capital costs associated with opening the outpatient clinic, which will be, uh, by the way, attached to our hospital wing. There will be no um, high expenses for retrofitting that wing of the hospital, as it is already um, structured to support these services. A telemedicine machine will be necessary at $20,000, with vital sign machines at uh, close to $2,000 for 3, and a vascular ultrasound Doppler at $5,000. The total operating cost is roughly estimated to be 937,000, with $163, which is a total of 24,397 small margin profit for the first fiscal year, and it's expected to continue to grow. Um, it is difficult to project the expected growth at this time without looking to see what the first year will truly provide. However, the data supports a positive outlook for this budget proposal based on the number of patients that will be routed to the outpatient clinic and the number of hospitalizations that will be prevented from this type of care. Um, we will evaluate the effectiveness and whether the plan is a return on investment uh, for this organization. We will do that by measuring the decrease in hospitalizations and readmissions to be at less than 10 per month. The second clinical performance indicator will be to uh, have a decrease in wound care um, complex management cases, which include infection um, and admissions to higher level of care, such as ICUs. Financial outcomes will be to um, decrease the amount of um, projected spending for the inpatient setting as we increase the revenue in an outpatient clinic setting. Um, the second, calculated benefits of savings from an outpatient service will, of course, be due to the shifting of inpatients to outpatient services. And other secondary benefits will be the overall increase in the quality of life for diabetic patients, which decrease the need for hospital high cost services overall and provide other beds for patients who have other conditions such as cancer or cardiac conditions. Overall, our goal is to increase the self care of every patient with high quality of life and a decreased dependence on hospital services. Marketing will be very important for this. At this time, we do not have a population that uh, is receiving uh, local outpatient services for this. We will need to create a brochure, which we've already done, and it looks like this: who we are, dietary services, our outpatient clinic cares and prevents uh, and provides effective wound care treatment. We are in touch with the American Diabetes Association. Our products and services provide timely access to care, electronic online access, expert dietitians, providers specializing in diabetes and complex wound care, friendly and compassionate diabetic self care, RN educators, laboratory and imaging immediate access. That is a big, uh, huge advantage for this population. Uh, and I think they'll find the brochure to be self explanatory in the pursuit for a warm and positive outpatient healthcare environment. Uh, Marketing will also include online, tapping into online social media um, advertisements that are linked to um, platforms like LinkedIn and Facebook, Instagram, and other uh, platforms that may provide news and opportunities to um, insert our advertisement and marketing into those areas. We believe that reaching out to our patients directly through phone and through emails, through texting, and through social media platforms, as well as um, electronic billboards, if it's within our budget, will be the key to bringing in the necessary clientele that we will need to not only cover the operating costs, but have a return on investment for the organization. Um, at this point, I can say that a lot of research has gone into this with respect to the effectiveness of having a specialized wound care nurse practitioner with a supporting team for this population. We expect that this is a revolutionary style of healthcare for complex wound care, and we uh, hope to get an approval for this budget plan. I will attach not only the brochure, but I will also attach the entire proposed budget plan for all of you. Thank you.